Assalamu alaikum everyone. This is Dr. Mubasshra and today I will go through a very important and basic entity of medicine, that is the art of history taking. I have chosen this topic so that it will be easy for you people to pass your postgraduate level exam in the clinical medicine. As we all know that history is very important when it comes to medicine. You can't diagnose if you don't take a proper history. This skill is not only important to pass your clinical exam, but it is also very important in our day-to-day practice, whether we are working in outpatient department or in the medical wards. All of you must have seen those patients who get too much obliged if you take a detailed and structured history from them. They will make you believe that you are a good doctor who has explored each and everything from inside of the patient without even performing any investigation yet. And they will put more trust on you. And they will even tell you all the confidential and personal things as well. So see how this history taking is so important. This lecture will be beneficial for all the candidates who are going to give their postgraduate level exam, whether it is FCPS Medicine, MD Medicine or MRCP PACES, and even for the postgraduate residents. Before the start of this lecture, I want to share with you people one very important thing, that when I was preparing for my postgraduate level exam, after completion of my residency, I felt and even I regretted as well that I should know all this history taking skill in my start of residency. So I believe that any one of you who is listening to my lecture, or he has started residency or is a junior resident, he should follow these steps in order to take a perfect history. So what are the steps of a perfect history? Let's talk about it. There are certain points which you need to follow. Number 1 point, make a roadmap. Make a roadmap before the start of history. I will guide you for both FCPS and MRCP exam. For example, if you are appearing in MRCP PACES exam, you will be given a scenario and time to read the scenario is almost 5 minutes. You will be given a paper as well, which you will take inside the exam hall for that long clinical consultation case. Now what will you do when you are outside? For in those 5 minutes you will read the scenario, and with that paper you will write the name and age of the patient which is given in the scenario, and check that whether you need to take the history from the patient or from the surrogate, and what is the relation of the surrogate with the patient. After that, read the presenting complaint carefully and think about the presenting complaint from 360-degree angle. Then write all the steps of the history which you need to ask inside. I will tell you these steps in a couple of minutes. However, if you are appearing in FCPS exam, consider yourself a lucky candidate if they hand over to you a paper even before your start of Viva or start of your long case. And consider yourself lucky that they will give you 1 to 2 minutes in order to write the roadmap or all the steps of the history taking. The second point is adequate control of nerves. We all know that exams are stressful, but why? If you have studied well and worked hard, leave everything on Allah Almighty. Your fate has already been written. Your task was to work for it, and now it is the time for relaxation and to be calm, especially in the exam, in order to give your best out of the best, because you are performing an exam at your spinal level. Your spinal reflexes are working, not your cortical reflexes, because you will not find time to think about the exam or think about the next step of your exam. So control your nerves and believe in yourself. This is the advice I want to give you people. Then come towards the third point, that a confident start is a key to success, because the examiners see the confidence in you and they like it, because your body language, your dressing counts a lot. The fourth point is building up the case. That is how you take the presenting complaint and carry it forwards. The fifth point is thorough and to the point history. For MRCP PACES, the examiner wants you to take to the point history and avoid any irrelevant questions. Sixth point is structured approach. I will explain you that how you can apply these points practically. Then follow all the steps in the sequence wise, because the sequenced history matters a lot. It's recommended that you complete one step and then move towards the next step instead of going haphazard in trying to complete and grasp each and everything quickly. And never rush towards your diagnosis and try to rule out all the possible differentials. And formulate your plan of action. That is, during your history, you will make up your mind that what you would like to see in the physical examination, what steps you will perform, and what clinical signs you may elicit in this patient, and how will you present this case to the examiner, and come out with a list of differential diagnoses and investigation plan accordingly, and all about that stuff. Now let's talk about the history taking steps. First of all, you will greet the examiner. Then you will greet the patient. After that, start with introduction. For example, for PACES candidates, you will start with like, hello, good morning, or hello, good evening. I am Dr. Mubasshra, one of the doctors in the medical ward. I have been asked to take your medical history, do your examination, and after that, I will answer and try to manage all of your concerns. Is that okay with you? So see, in this way, you have covered not only introduction but consent as well. And in case of FCPS exam, you will say, मेरा नाम डॉक्टर मुबशरा है, मैंने आपकी बीमारी के मुताबिक चंद सवालात करने हैं, फिर मैं आपका मुआयना करूँगी और इस दौरान आपको कोई तकलीफ़ हुई तो आप मुझे बताइएगा. In this way, you have completed introduction and consent as well. After that, you will check the identity. For example, if you are appearing in PACES exam, you will check the identity in this way that, for example, are you Mr. Zia, 60 years old? I mean both name as well as age. But in case of FCPS exam, you have to ask all biodata. That is, make a mnemonic of biodata. Some people make mnemonic of negrioma. When I was preparing for my exam, I made the mnemonic name, fam, and dam. What name means? Name of the patient. F for father's name or husband name. A for age. M for marital status. E for education. D for date of admission. M for mode of admission, and A for address. After that, come towards the next step, that is the presenting complaint. In PACES, you will ask, can you please tell me in your own words what brought you to the clinic today? Some candidates also ask the presenting complaint in such a way that, for example, I was going through your GP notes and I came to know that you are suffering from this problem. But still, I would recommend that give an open-ended question to the patient or the surrogate and ask from his own words that what brought him to the clinic today. And similarly, in case of FCPS exam, you will ask कि मुझे अपने अल्फाज में बताएं कि आप किस तकलीफ़ के साथ अस्पताल तशरीफ़ लाई. One thing more which I want to tell you people here is that whatever clinical medicine exam you are appearing, you should feel like that your patient today is a VIP. Give him a VIP protocol. So, coming towards the presenting complaint, one thing more, that only choose one presenting complaint. It will be easy for you to take your case forward because presenting complaint is always one and rest are all its associations. Then comes history of presenting illness. I will elaborate it for you people in a couple of minutes because first I need to complete this roadmap of history taking. So after completing your history of presenting illness, you will move forward to the next step, that is general questions or constitutional symptoms. And these are very, very important in case of any history. After that, systemic review. Systemic review of rest all systems. This systemic review is important in case of FCPS exam However, if you skip this step in PACES exam, the examiners will not mind. After that, the famous mnemonic PAM, HUG, FOSS, TBF, or whatever mnemonic you have made. I will elaborate it in detail in both Urdu as well as in English. That is past history, allergies, medication history, family history, occupational history, social history, and many things come under this heading of social history. So this was all about history taking steps. After that, we will move forward towards the very important and crucial step in any exam you are appearing, whether it is clinical exam or it is written exam. This time management is very important. In long clinical consultation or long case, always divide your time. For example, if you are appearing in FCPS exam, you need to take your history in 8 to 10 minutes. After 10 minutes, you must get up from the chair and start the examination, because if you keep on taking history, this will leave a very bad impression on the examiner. They will not bother that you have took a very good history or you have come towards the diagnosis. They just want that how you manage the time. So after 10 minutes, you should complete at least HOPI or at least towards your differentials. And after that, you will start the examination. And in case of FCPS, you can take the history during your examination. However, some examiners do not like it. But still, you are allowed to take the history, especially you can perform systemic review questions, which are not quite important in some cases. And after, for example, you have completed the examination in 10 minutes, this make a total time of 20 minutes. Still, you are left with 10 minutes. After that, you can sit with the patient and you can complete the next steps of your history. But if you are appearing in MRCP PACES exam, I would recommend that 6 to 8 minutes history, complete history is more than enough. I mean, at 8 minutes time, you should have completed your social history. After that, start the examination, and when the 2 minutes are left or 3 minutes are left, you can answer the concerns of the patient. Now come towards the presenting complaint. As I was telling you before as well, that your presenting complaint is only one, because it will be easy for you people to take the case forward. Because if the patient tells you that I have this problem as well as this problem, you have to complete all the relevant questions of both the problems. So it is better that you take one presenting complaint out of the two and keep the other presenting complaint as association and complete the steps in this way. How you will complete the steps? OD para. We all know this famous mnemonic. O stands for onset, D stands for duration, I for intensity, P for progression, A aggravating factors, relieving factors, and associations. For example, let me give you an example that you are appearing in MRCP PACES exam. Your history should be very fluent. How you will ask this OD para of any presenting complaint? You will start, for example, you will ask the patient, can you please tell me what brought you to the clinic today? He will tell you. After that, you will ask, okay, I'm so sorry to hear that. I will try to help you out and we will sort it out. Okay. Then you will ask how it started, gradually or suddenly. You will give the patient option, because sometimes they don't know how it started. So you will give the patient option, gradually or suddenly. After that, you will ask, since how long you have this? Is it severe or bearable? Is it getting worse or the same? Anything which makes it better? Anything which makes it worse? So it will take only few minutes to complete your OD para. And in case of FCPS exam, you will ask, ये मसला किस तरह शुरू हुआ, अचानक से या आहिस्ता आहिस्ता? ये मसला कब से है, बहुत शदीद है या काबिल बर्दाश्त है? जब से मसला शुरू हुआ है तब से इतना ही है या बढ़ रहा है? क्या आपने महसूस किया कि किसी चीज़ से ये बेहतर हो जाता है, या वक्त के साथ साथ ये किसी चीज़ से बढ़ रहा है, और इसके साथ और क्या इलामात हैं? For example, in case of FCPS, you will ask the patient associations in the form of open-ended question. But for PACES, it is recommended that you will ask the associations yourself. If your presenting complaint is pain, then you should apply this formula of Lokira or Socrates, whatever you feel better. LUCIRA stands for location, onset, quality of pain, intensity of pain, radiation, relieving factor, aggravating factor, and associations. So, how you will ask these questions? Where exactly you have the pain? How it started, gradually or suddenly? What is the character of pain? Is it sharp, stabbing, dull, boring, throbbing, pulsating type of pain, heaviness, or dragging sensation? Is the pain severe or mild? If I give you a pain scale of 1 to 10, where 1 is mild pain and 10 is very severe pain, what is your pain severity score? Does the pain go anywhere else? Anything which makes it better? Anything which makes it worse? So it will not take 1 or 2 minutes for these type of questions. However, if you are appearing in FCPS exam, then you will ask, आपको दर्द कहाँ पर है, हाथ रख कर बताएं, ये दर्द कब से है, दर्द किस तरह का है, तेज़, चुभता हुआ, खिंचाऊ या दबाव या वज़न की तरह का, दर्द की शिद्दत कितनी होती है, क्या बहुत शदीद दर्द होता है या काबिल बर्दाश्त। अगर मैं आपको 1 से 10 तक स्कोर दूं, जिसमें 1 का मतलब है मामूली दर्द और 10 का मतलब है बहुत शदीद दर्द, तो आपका दर्द इस स्कोर में कितना होता है? ये दर्द यहीं पर रहता है या कहीं और भी जाता है? दर्द कैसे ठीक होता है और दर्द किस तरह ज़्यादा बढ़ जाता है? इस दर्द के साथ और क्या इलामात होती हैं? Then you will give another open-ended question after presenting complaint in the form of what associated symptoms you have with this pain. Sometimes you need to give the patient options of aggravating and relieving factors. For example, patient has presented with headache and you will ask, does the headache increase by bending forward, straining, coughing or sneezing? And how you will ask these questions in Urdu? You will ask, दर्द आगे की तरफ झुकने से, खांसने से या छींकने से बढ़ जाता है? And for relieving you can ask about rest or painkiller. So, after completing OD para or LUCIRA, you will move towards the next step. And what is your next step? Next step is the system. For example, you have completed the question of OD para. Now you will come to know that what system you are running with. For example, the patient is presenting with cough. You will know that this system is respiratory system. So you will ask all the questions of respiratory system after your OD para. And after this, sometimes what happen that even after completion of OD para, still you are not sure that what system you are running with. For example, the patient has presented with general or constitutional symptoms like fever, fatigue, weight gain, weight loss, increased sweating, lumps and bumps, skin rash, or something like that. Here you will ask about the general questions or constitutional questions first before the next step. This DEC and MI, this is the basically mnemonic which we made during our preparation of FCPS exam. This is basically important in case of FCPS. DEC stands for diagnosis, differential diagnosis, etiology, complications, management and investigations. So here you will rule out all the possible differential diagnoses. You will ask about the etiology and you will elicit the complications according to your presenting complaint and according to your provisional diagnosis. And even you will ask about what investigations have been performed yet and what management has been done yet. This DEC MI is basically important in case of FCPS exam and this is not usually necessary in case of MRCP exam. However, in case of MRCP, you will ask about all the possible differentials. Not all the possible differential, at least 3 to 4 important differentials about the presenting complaint. And only few questions regarding etiology and few questions regarding complications. Not the detail or all the questions which we need to ask in our FCPS exam. However, just touch this and MI is basically not needed in case of PACES exam. Okay, now coming towards the general questions. What general questions you should ask in all of your histories? Fever. If there is fever, you will ask about the pattern. Basically, for each presenting complaint, there is a different approach. Here, I am just giving you a layout of history taking. So, general questions basically include fever, night sweats, fatigue, lethargy, malaise, increased feeling of tiredness, weight changes in the form of weight gain or weight loss, appetite, increase appetite, decrease appetite, joint pain, weather preference, lumps and bumps anywhere on the body, and even skin rash. And in the past history, you will ask about medical history in the form of comorbidities. Basically, the mindset of MRCP exam and FCPS exam is a bit different, because in case of FCPS exam, you should ask about the comorbidities even before start of OD para. But PACES examiners want you that you ask about the comorbidities in the past history. Then ask about surgical history, hospitalization, any similar complaint in the past, and how is the control of comorbidities and regular follow-up. In the medication history, even before medication history, you will ask about allergies. In allergies, not only allergy to medications, it is basically about food allergy, pollen allergy as well. So in medication history, you will ask about any regular medication. If the patient is taking, you can ask about the list of medications. Usually the PACES candidates will get this list, but mostly not in case of FCPS exam. Then you will ask about the compliance to that medication, and any over-the-counter medication or any Hakim medication or herbal preparation, and side effects of the medications. After that, you will move forward toward the next step of the history, that is family history. Important questions in family history include history of similar illness in the family, any disease which runs in the family, any history of cancer in the family, or any history of comorbidities in the family like diabetes, hypertension, tuberculosis, or hepatitis. Then if your patient is female, you will need to ask gynecological history. Remember the 3P: oral contraceptive pills, periods, and pregnancy. And especially if you are running with a case of connective tissue disorder, you need to ask any previous miscarriages here. In the personal history, you will ask about smoking, alcohol, illicit recreational party drugs, and even sexual history if it is relevant to your case. And even before asking about these smoking, alcohol, and personal history questions, you should give a warning shot to the patient, ये that you will say कि मैं आपसे कुछ ज़ाती नोयत के सवाल करूँगा, लेकिन ये सवाल हम हर मरीज़ से करते हैं और ये आपके मर्ज़ की तशख़ीस के लिए ज़रूरी हैं. And similarly in PACES, you will ask that now I want to ask some personal questions from you, but let me tell you that they will be kept confidential, and we ask these questions from all of our patients. Then in social history, you will ask about job, any previous job, occupation, and impact of the disease or presenting complaint on the life of the patient and daily routine. Then you need to ask about driving. This driving is basically important in case of PACES exam. And then travel history. Each part has its own set of questions, but always try to ask at least 2 to 3 questions from each part. For example, in travel history, everybody has traveled. You just need to ask any significant travel history before the onset of these symptoms. And for example, you are dealing with a case, for example, it is a communicable disease in the form of tuberculosis or traveler's diarrhea or something like that. You need to explore the travel history more. After that, always remember the common complaints, because when you will prepare for your history, if you know the common complaints of each system, it will be easy for you to prepare. For example, in case of pulmonology, there are few presenting complaints only. For example, the case will come with cough or shortness of breath, hemoptysis, or pleuritic type chest pain. Similarly, in case of abdomen or GIT, you can get the presenting complaint of epigastric pain, right hypochondrium pain, jaundice, vomiting, loose motions, hematemesis or melena, dysphagia, abdominal pain, abdominal distension, altered bowel habit, bloody diarrhea, or heaviness in the right hypochondrium. In case of cardiology, you can get the presenting complaint of shortness of breath, chest pain, palpitations, or even fever if it is a case of rheumatic fever or infective endocarditis. Similarly, if you are dealing with a long case of central nervous system or neurology, you can get the presenting complaint of altered state of consciousness, weakness of lower limbs, ataxia or difficulty in walking, hemiplegia or weakness of one half of the body, or even tremors. And in case of rheumatology, you can get joint pain, joint swelling, proximal myopathy, skin rash, blurring of vision, as well as painful red eyes, oral ulcers, backache, knee pain, Raynaud's phenomena, skin discoloration of fingers, even dysphagia and shortness of breath as well. And for endocrinology, your presenting complaint will be weight gain, weight loss, heat intolerance, palpitations, fatigue, lethargy, polyuria, polydipsia, and proximal myopathy. Now let's take an example. For example, if you are dealing with cough, patient has presented with cough, now you come to know that you are dealing with the system of pulmonology. So here you need to remember what differentials of cough you can make. It can be productive cough, wet cough, or it can be dry cough. In case of productive cough, what differentials will you make? Chronic bronchitis, bronchiectasis, carcinoma lung, tuberculosis, lung abscess, and pneumonia. And in case of dry cough, you will know about interstitial lung disease, idiopathic pulmonary fibrosis, emphysema, asthma, or bronchogenic carcinoma. So, one or two questions of each differential you need to ask in your history. After that, come towards complications and etiology. You need to ask about recurrent infections, respiratory failure, lung cancer, pulmonary hypertension, and cor pulmonale. And in etiology, you will ask about smoking, occupational hazards, environmental toxins, and associated conditions. In social history, you will ask about smoking, alcohol, illicit drugs, job, occupation, impact on daily living, sexual history, vaccination history, travel history, driving history, and history of contact with tuberculosis patients. Your presentation skills matter a lot. Confidence, fluent and slick presentation, sequence wise, positive findings first, important negatives at the end, and avoid any extra no. Correlation and diagnostic approach. This is the key to success. If you find this video useful, please like this video and subscribe to my channel. Thank you so much for watching. Stay blessed. Allah Hafiz.